PHS Clinic. Yes, hello ma'am.
Maayong adlaw Negros kag Bacolod. Yari naman kami para magadulong sa inyo sang isa ka special feature diri lamang sa The CLMMRH Insider. Sa pagsugod sang pandemya, pila ka mga empleyado sang CLMMRH ang nagka-COVID. Tungod sa madamo nga mga protocols ang ina-implementar sa mga local government units, ang CLMMRH nag-ubra sang tikang para maging mas kumbinyente ang pag-isolate sang amon mga empleyado. Sang 2021, matapos maaprobar sang local government unit sang Bacolod, kinlunsad sang CLMMRH ang Hospital-supervised Home Isolation Program. Ano bala ini nga programa sang ospital?
I'm Dr. Eirene Ayalin, the chairperson of the Department of Family and Community Medicine and also the head of the Personal Health Services Clinic, which is known as the Employees Clinic in other institutions. So, one of the services offered by our hospital is the HSHI, which stands for Hospital-supervised Home Isolation Program. So this is a program established June 2021. So this is a program established for our COVID-19 affected personnel to take care of them, including their household contacts. So what happens when a patient or a personnel, particularly our personnel, is affected with COVID-19? So many damo gid involved in this process. Once one of our personnel turned out positive for COVID-19. So the Personal Health Services Clinic, this is our employees clinic, is being manned mainly by our consultants and residents of the Department of Family and Community Medicine. So once the results are in, we inform our personnel of their swab test results. And then these personnel were endorsed to the Department of Internal Medicine. They do the contact tracing of the COVID positive personnel.
Kung may ara sang empleyado nga magpositibo sa COVID, ano bala ang iya maekspektar halin sa ospital nga suporta?
In our HSHI, there are several criteria which have to be fulfilled before they can be accepted in this program. So I would like to mention yung criteria. Number one is that our personnel should be a resident of Bacolod. So this is offered exclusively for Bacolod residents only. So they have to have the laboratory confirmed COVID, and then they should qualify for, like, okay, they could either be asymptomatic or they should have mild symptoms, and there are several qualifications which they fulfill, particularly in their home. So like they should have a room of their own where they can be isolated, and they should have a primary caretaker who has no comorbid illness. So our personnel who has a comorbid illness could also be accepted in the program provided that the comorbid illness is controlled. So though kung ma-evaluate sang consultants na they need to be evaluated, ginasugat na sila. So this is one of the services pa being offered by the hospital. Ginasugat sila sang aton ambulance and ginadala na sila sa aton na emergency department for them to be evaluated by the residents of either by the residents of the family and community medicine or the emergency medicine, and then referred to the Department of Internal Medicine if they need to be admitted. So once they are evaluated and then they think na they can just stay at home, they can be managed at home, then ginabalik na sila sang HEMB sa Ilabalay, and that's when yun na yung mag-start na yung home care of our personnel. And if ever our personnel or one of his or her household contacts develop symptoms, like difficulty of breathing, chest pain, worsening symptoms which could suggest progression of the disease, they are then advised to go to the emergency department for evaluation and possible admission. So if ever our personnel was able to finish the recommended isolation period, it is the Personal Health Services Clinic which determines whether the personnel is already fit to return back to work.
Kaupod sang Personal Health Services Team kag Health Emergency Management Bureau, ang Department of Internal Medicine Consultants ang aktibo nga naga-contact trace sa mga empleyado namon nga nagpositibo sang COVID-19. Ano bala ang maekspektar sa mga empleyado kung matawagan sila sang aton mga contact tracers?
Good day. I am Dr. Jodette Lavente, a cardiologist from the Department of Internal Medicine. I am the head of the Internal Medicine Community Contact Tracers. At the start of the COVID-19 pandemic, there were only 4 consultant volunteers in the team, namely Dr. Celestelin Villarosa, Dr. Rhea Joy Tabuhara, Dr. Maricris Araneta, and me. But as the number of healthcare workers who get COVID-19 infection is increased, we are very fortunate that more IM consultants have volunteered, and these are Dr. Michelle Tolosa, Dr. Catherine Doyonco, Dr. Chris Manuel, Dr. Norman Cabaya, Dr. Orabel Libutan, Dr. Therese Sunye, and Dr. Catherine Go. The purpose of our team is to check the feasibility of the personnel's residence for the hospital-supervised COVID-19 home isolation and care program, assess the personnel's clinical status and need for medical evaluation, and to trace the personnel's household and community contacts. We usually interview the positive healthcare workers once the positive line list is released. Personnel is deemed qualified for home isolation if he or she is asymptomatic or has mild illness, with stable comorbidities, fully vaccinated, has own room and dedicated toilet, and functioning phone line or internet. After the interview, we give our recommendations to the Health Emergency Management Bureau for assessment.
Amon gid ginapanginbulahan kag ginapasalamatan ang CLMMRH Management kag ang mga grupo sa likod sang sininga programa sang ospital. Tungod diri, madamo sa amon nga mga empleyado ang pwede na lamang mag-isolate sang ilang mga puluyan kag hindi na mapalayo sa ilang mga pamilya. Bago kita magtakop, ang CLMMRH nagabaton lamang sa subong sang coordinated referrals. Para hindi mabudlayan ang aton nga mga pasyente, yari ang mga hospital hotline para sa coordinated transfers. Para sa mga nagakalatabo diri sa CLMMRH, like and follow us sa Facebook, Instagram kag YouTube. Mga kasimanwa, padayon kita nga magahalong kag mag-obserbar sa mga health protocol kag magbato na sang bakuna batok sa COVID-19, ilabi na gid sa subong nga tiempo. Kita ay kitaliwat sa masunod nga episode. Sa liwat, puligi kami sa gihapon nga maserbisyohan namon kamo sang maayo. Ini si Ray Mirasol para sa The CLMMRH Insider by Horizon.